One more for today. Yeah. So a person who didn't want a name check asked, and I thought it's probably worth responding about a story that was just in the Telegraph. And the story is about bald men having a higher risk for COVID. And so, first of all, let's just say that there is a line of logic here where it could make sense, but it's going to be one of those stories where the data is not not strong enough that we're sure it actually works the way it makes sense. It's just that it could. So, all right, let's try it. So, testosterone is one of these chemicals. It's called an androgen. It's a thing which makes you what we consider masculine. All those traits. And in abundance, it does cause hair to fall out after a certain time. And that's correlated. It's not the only thing that drives that process, but it's one of the drivers. And so that's fine. The other things that we know about testosterone levels, and there are different kinds. And for purpose of this, whatever, that's a different biology class. Let's just call it testosterone levels. But we're meaning the locked-in version of testosterone. There's some versions that can flip back and forth to other things. And there's one version that kind of, once it gets there, I believe it is kind of stuck as being this kind of testosterone forever. We know that testosterone has an effect on ACE2. More testosterone, more ACE2, which leads to more infection. That's been shown in the laboratory. And I had also seen a paper that more testosterone leads to an increase, in some tissues anyway, in the expression of TMPRSS2, which is one of the other things that the virus needs to get in. This is one of those proteases that's going to give the virus that little snip so it can unfold just right and basically hook the other cell and get in. And we also know that those two things tend to clump together on the surface of the cell, which makes it just a great one-stop shop for the virus and kind of bad for us. These things have other uses. They're not there for the virus's use. But this is a case where it happens to be very unfortunate that they are linked like that. So, does baldness doesn't cause COVID. That's dumb. Is it a predisposing factor? That's a little smarter way to ask that question. Because no, SARS coronavirus 2 causes COVID-19. That's well established. So the information is coming from a particular doctor, and he's been hammering on this particular line. He published 2 papers, and they're both with kind of small samples. At least one is coming out of Spain. I think they might both be out of Spain. And the thing is, even though it makes sense to properly do this study, what you want to do is make sure you have an age-matched set. So you need to have people of the same age who have lots of hair and no hair. You would need to quantify exactly what you mean, because you can't just say, bald, sure, tick a box, yeah, because they're going to be different levels, right? And how are you measuring it? There's a lot of hair around here, but not so much up here. What does that mean? If you have a bald patch here, is that 25% bald? You need to say exactly what you're measuring, exactly how you're measuring it, because otherwise it's going to be real prone to biases of different kinds, where you will essentially be determining the outcome of the experiment based on something that is going to be difficult to reproduce, or at least tying the result to that. It's going to be on, what's your opinion of bald? Yeah, yeah. And so tough experiment to actually do well. Hasn't been done thoroughly to a level where I think we can confidently say that, there's a reasonable likelihood. But it does remain a possibility. Now, as to the question of what can you do about it, the answer is no, we don't have a lot of things that you can do about it. They've tried sort of feminizing hormone therapy to try and counteract the testosterone. I have not yet seen the results on that. I doubt that would work particularly well, because it's not so much one thing competing with the other one. I think it's probably going to be a pathway that is just turned on by testosterone. And unless you can find a way to shut down the enzymes that actually lock testosterone into that most powerful, potent conformation, I don't know how. Yeah, I don't know how you could even give therapy. There's no therapy that stops you being male. Yeah, as far as I'm aware, that would work in a clinical setting on a COVID patient. Yeah, there are things you can do that will eventually, over a long period of time and continual use, yeah, you can. They would do this on the way to a sex change or something like that, but this is not, or gender reassignment, I guess is the right way to say that. But yeah, I don't know that there's any real clear path to therapeutically doing this. And I also think that would just make people crazy, like pitchforks in the street crazy. Yeah. So there you go. Yeah, good question. I'm glad it got asked. And yeah, I hope that was of some use to you. Whether or not you have hair, I think the key is just don't catch COVID and, or rather, don't catch SARS-CoV-2, and then everything is much, much better. Thanks very much. This is Ask Dr. Ben.